We can't laugh about this story. Front page of The Age as well, the headline tomorrow, hospital patients waiting in tents. Now, this has been a big story here in Victoria today, but I think it's a story that needs to be told around the nation. The story says doctors say people have been deteriorating in quote-unquote holding areas for ambulance patients queued at Victorian hospitals as an account of a woman being treated in a tent at Box Hill puts a spotlight on those enduring extremely long waits in emergency wards. The number of patients spending more than 24 hours in emergency wards in Victoria rose sharply to 1,844 between April and June, a more than fourfold increase compared with the same period last year. I mean, if you've got to start putting people who rock up in ambulances in tents outside of emergency waiting rooms, and we had a case, as is mentioned in this story today, of a woman who got to hospital last night after having a stroke. She was in this tent all night, overnight. She was still there this morning. She didn't get through the front door of the hospital, Carolee, until 1 p.m. today. She had a...
That's shocking. Shocking. Well, look, over here in Western Australia, we've got almost a very similar situation. In the paper, we have had photos that have shown that there are now red-taped areas in corridors that are being used to actually treat patients, and it's sort of been quite eye-raising. As you know, we've had dreadful problems with our ambulance ramping. It's at record high levels. Our hospital is under absolute chaos. There's just too much to even go into. But what has become very clear is that here in WA, as you know, we had a hard border imposed for almost 2 years, and it was under the guise of getting our hospital system up to scratch in case the COVID came over. As we know, it did, but it just has laid bare the dreadful, dreadful under-resourcing that has been done in the last 6 years of this state Labor government, where really nothing has changed. Staff are very frustrated, and you know, we've had 3 West Australians die waiting for ambulances as well. So with the problems that you've got there, that is terrible intense. We've got them replicated over here, and in recent days, early in the morning when I start work, there was something like a 6-hour and a 4-hour wait in a couple of our public hospitals here in emergency. It just shows that, very sadly, the health system in both your state and our state and across Australia has just been allowed to really go to rack and ruin, and there's been severe under-resourcing, which really shouldn't be happening in 2022, not in a Western country.
I mean, it's such
like
a basic thing for a government to be on top of. You know, it's such a basic thing, and they just can't do it.